Hello, good day, dear learners. Today we are going to start unit number 2, Proqual Level 7 Diploma in Strategic Health and Safety Management and Leadership. We will discuss this unit in detail, and before uh, starting this unit, I just want to share some information with you as I am receiving some questions on that. The thing is that everyone is asking for the course material for these qualifications. Do remember that NVQ qualifications and these RQF qualifications are work-based. Here, you are not supposed to be provided by any course material, any books, anything from the center or even from the awarding body. So what you have to do, that whatever I am discussing with you with regard to these qualifications, you should remember that you have to take guidance from these lectures, and then you have to produce the coursework from your organization, from your daily routine responsibilities, that what you are or what are your day-to-day operations while performing your jobs. So you have to produce the coursework according to your workplace. What I am doing here, that normally you don't see any type of lectures or classes from any assessor normally, or for these qualifications normally. So what you have to do, you have to take guidance from my lectures and then go back to your workplace and collect evidences and information which are required by these qualifications. I hope you will understand that what I want to guide you. So moving forward with respect to this lecture, that here what we have to do, we are going to start the unit number 2 of Proqual Level 7 Diploma in Strategic Health and Safety Management and Leadership. The unit number is F/618/5597. It is the second unit of this level 7 diploma, and the unit title is Safety Culture, Sustainability, and the Global Effect on Performance. So what you have to see here, so we will discuss the safety culture, sustainability, and the global effect on performance. Before going forward, what we will do, we will discuss the name of the unit to get better understanding of the course work. First thing in the name of the unit is safety culture. So normally what is culture? When you are having shared attitude, beliefs in a society, we call it culture. But when it comes to safety culture, it's mean that the worker, the employees, the people present in an organization, and what is their shared attitude, beliefs, thinking about the health and safety. We call it safety culture. It can be negative, it can be positive. Then we have sustainability. I just want to clear something here with this word, because many times the learners who are doing this qualification are from the environment background. So there are two different meanings of this sustainability when it comes to normal usage of this word, and secondly, when it comes to we use this word in environment. I will explain the both. Normally, and what is the meaning, we will take from the word sustainability here is to maintain something at a specific level. We call it sustainability. Okay, sustain, to remain, to maintain a specific level. It is sustainability in general. But in environment management system, or in environment, the word sustainability means to avoid the depletion of natural resources whenever you want to achieve betterment in the environment. I will call it again. In environmental management system, the sustainability means that you are doing good, you are performing well for the management of environment, but you are not destroying the future resources of the world, or you can say of the region. We call it sustainability. But here the meaning which we will carry in all the in this unit will be that to maintain maintain a specific level. So basically, sustainability is here that in the top management, you have to maintain a specific level in the management and the global effect on performance. Global effect means that the organizations are working in this world in different regions, but after you can say 20th century, now the world is become global. So what happened, that there is a connection between each region, each country. So there are a lot of even interconnections there. So definitely there will be a effect coming from globally. So in this unit, we will discuss the safety culture of the organization, sustainability and the global effect on the performance of that specific organization. So whatever we will discuss, you have to mold that, you have to take information, you have to apply all that things on your organization. So here it is explaining again. This unit aims to provide candidates with the knowledge of sustainability effects on safety culture, the psychological factors affecting safely. Psychological means that's like stress, strain, mental conditions changing, and they can affect the working or safety. A whole organization approach to occupational health and safety and the measurement of safety performance. So secondly, first thing will be all about the safety culture, sustainability effects on safety culture, the psychological factors we will discuss, and a whole organization approach, like what is the approach of organization with respect to health and safety and the measurement of safety performance. So moving forward, now we have learning outcome. Oh, okay. Before going forward, there are, for achieving this qualification, for the achieving this unit successfully, what you have to do, you have to meet 5 learning outcomes. There are 5 learning outcomes in this unit, and in total there are 24 assessment criteria. 5 learning LOs are there and the 24 ACs are there. Assessment criteria are 24 there. So in learning outcome 1, we have 5 assessment criteria. Learning outcome 2, we have 3 assessment criteria. And learning outcome 3, we have 3 assessment criteria. The learning outcome 4 has 8 assessment criteria, and the learning outcome 5 has 5 assessment criteria. To successfully complete this unit, we have to meet all these assessment criteria. So starting from the first learning outcome, number 1, be able to evaluate the effects of global issues on safety culture. In this learning outcome, the learner will be able, for what he will be able to evaluate, to perform the assessments of what the effects of global issues, like you are having global issues and that are affecting your organization's safety culture. So you will become able to evaluate the effects that are affecting due to the global issues on your organization's safety culture. So we have assessment criteria. Number 1, the 1.1 assessment criteria is evaluate the impact of globalization on the safety climate of an organization. In this assessment criteria, you have to explain that how you are evaluating the impact of globalization on the safety climate of your organization. First, you have to explain that. To strengthen your explanation, you should provide any evidence here that what type of assessments you are performing now and what type of assessments you have performed in the past to see the impact of globalization on the safety climate of your organization. Like what impact created by globalization on your organization's safety culture, how you have assessed that, how you have evaluated that. You have to provide some evidences along with your explanation. Then secondly, one more thing I want to add here, that some of the learners are having, because most of the time learners are not directly uh, enrolled with me, they are coming through some associates or some partners, so they have some questions there, and sometimes they said that we are not getting enough information or we are not getting the proper understanding. The simple thing is that it is it don't matter to me that from where you have came to me. So what you have to do, my phone number is available on this channel. In the description of this lecture, you can WhatsApp me and ask any query what you have. I will definitely respond to that. Thank you very much. Now 1.2, analyze the way in which perceptions of safety and unsafe behavior vary between various countries. As I have told you earlier, that when it comes to culture, these are some specific shared values, attitude, beliefs of people. So definitely, when you are having organizations in different parts of the world, you have different behaviors. Some performing or carrying out their activities with the great standards of health and safety. Some are doing average, and some are very poor in that. So that can be that can vary. So here it is asking for analysis. The analysis is about 1.2, analyze the way in which perceptions of safety and unsafe behavior vary between various countries. Before going forward, what are basically perceptions? Perceptions are normally anyone's opinion. So here perception means perceptions of safety, that anyone having his opinion about the health and safety. So many times you have seen that for perception we use our five senses, but when it comes to specifically health and safety, other than these five senses, we should have three different types of knowledge required for the better perception about the health and safety. Other than our five senses, human five senses, what are the three knowledge are there which are required for better perception of safety? Three knowledge. Number one, common knowledge. Number two, industrial knowledge. And number three, expert knowledge. So other than five senses, in health and safety, for better perception of safety, the better perception of safety risk, and better perception of safety controls, so you should have three knowledge: common knowledge, industrial knowledge, and expert knowledge. So this should be there for better perception of safety. So here it is asking that you have to analyze the way in which perception of safety and unsafe behavior vary between the various countries. So you have to analyze and you have to explain that which perceptions of safety, why unsafe behavior vary between different countries. Like someone in the Europe, UK, they are having different perception of safety. Here in the Middle East, in the subcontinent, we are having different perceptions of safety and unsafe behavior. So you have to explain that. And if to support your answer, if you have performed some specific paper-based analysis, you can use that here as an evidence for your explanation, what you have explained in response to this 1.2 assessment criteria. In 1.3, evaluate the role of management in ensuring the development of a worker's competence within their role. As all of you know very well, that these are the 4 main responsibilities of the employer or the top management when it comes to occupational health and safety management system. Safe place of work, safe plant and equipment, then safe system of work, and the last one is training, supervision, and competence of staff. Normally, all of you know this very well because it is a requirement, it is a responsibility on the employer from C155, article number 16. So here in this assessment criteria, it is asking from you, you have to evaluate in your organization what is the role of top management in ensuring the development of workers' competence. Competence means a term related to it is KATE, knowledge, ability, training, and experience. So what top management is doing, what is the role of top management in the development of workers' competence, you have to explain here. And for evidence to support your answer, you can use any program your organization is having to develop the competence, to develop the workers' competence in your organization can be used here as an evidence. So you can produce here that document. Then 1.4, develop practicable and operational plans for the effective management of occupational health and safety in a multi-employer work site. So basically, it is just discussing about a work site which is shared by different employers. So it is discussing about the shared premises, it is discussing about the shared workplaces. So develop practicable and operational plans for the effective management of occupational health and safety in a multi-employer work site. So here, what is required? You have to explain that how you can develop practicable and operational plans for the effective management of occupational health and safety in a multi-employer work site. That more than one employer is working in a site. So it is normal. It is normal in the big organizations that more than one organization is working there because of their because of the nature of their operations. They are working there, they are present there, and a lot of contractors, subcontractors, and many other organizations are there. Even things are going on with different in a groups. And normally, sometimes what happened that different companies, different organizations are doing the joint ventures. So how you can manage that work with respect to health and safety? You have to develop practicable and operational plans for that. You have to explain that. And if you have any plan developed before in your organization, you can use here as an evidence. The last assessment criteria for learning outcome 1 is analyze the way in which globally harmonized systems could improve the communication of hazards and risks. First, you have to explain here that what are the globally harmonized systems, like that systems which are equally good in every part of the world. So you have to explain the globally harmonized system, and then you have to explain how these globally harmonized systems improve the communication of hazard and risk. And then you have to explain in your organization how these globally harmonized systems improved the communication of hazard and risk in your organization, and what globally harmonized systems your organization has adopted. You have to give any evidence of that. Now we have completed the learning outcome 1 and its 5 assessment criteria. Now we are at learning outcome 2, in which we have 3 assessment criteria. Number 2 learning outcome is evaluate the benefits of sustainability in the workplace. That the purpose of this learning outcome is that you can assess, you can perform the assessment, you can do the evaluation of what the benefits of sustainability in the workplace. That sustainability in the workplace means that in your organization specific levels are achieved, and that specific levels are maintained in your organization. So going forward in 2.1, we have developed a business case for the inclusion of occupational health and safety in sustainability strategies. So you have to develop here a business case for your organization for the inclusion of occupational health and safety in sustainability strategies. It means that you are establishing sustainability strategies in your organization. Then you should have a plan there. You should include the occupational health and safety in sustainability strategies. So if you have that plan, if you have done that in the past, you can use that plan as a evidence here, and you have to explain that how we can include occupational health and safety in sustainability strategies. So sustainability, what is sustainability here? Like you have achieved some standards, some specific levels, and now you have to maintain that specific levels or standards. Now 2.2, evaluate the challenges, opportunities, and strategic business benefits in promoting sustainable workplace health and safety. In your organization, you have to evaluate. You have to evaluate the challenges you and your organization is facing while promoting sustainable workplace health and safety, and what are the opportunities you have in your organization for promoting sustainable workplace health and safety, and strategic business benefits, and what type of benefits your organization will enjoy in promoting sustainable workplace health and safety. So you have to explain that in three different portions. Like the first one is sections, you can say. The first section will be about your organization is facing the challenges in promoting sustainable workplace health and safety, and what are the opportunities. The second section will be opportunities your organization has for promoting sustainable workplace health and safety, and what will be the strategic business benefits your organization will enjoy once they have a sustainable workplace health and safety there. So you have to explain these, and what you have performed in the past or what you are doing now in present in your organization with respect to these things. You can provide the evidences of that, and that can help the cause of help the cause of strengthening your explanation. Now 2.3, specify the methods to be included that measure a sustainable occupational health and safety practice in workplaces. So you have to specify the methods. Which methods? That methods can be used for measuring the sustainability of occupational health and safety practice in the workplace. Like for example, you are saying that we have promote sustainability in our organization, in our health and safety, occupational health and safety management system. So whether that sustainability is there or not, you have to measure that. You should, if you need some outcomes, if you need some information that how good that is going on, then you should specify, you should you can say you should develop some methods, or you should use some methods to be included that measure sustainable occupational health and safety practice in workplace. So you have to explain here that method that can be used for the measurement of sustainable occupational health and safety practice in the workplaces. Now we have the third learning outcome. The third learning outcome is be able to measure safety performance and calculate safety return on any investment. This learning outcome is all about measuring safety performance and calculating the safety returns, means the profits your organization is enjoying in return to whatever the investment you have made, whatever the investment made by your organization, whether it's in terms of finance, whether in terms of human resource, whether in terms of anything, what they have, like the time. There are basically three main factors that can be used, or you can say that can be considered in terms of investment. That are the human resource involvement, the finance involvement, and the time involvement. These are the three basic factors which we consider as an investment. So in this learning outcome, we will see that whether you are be able to measure what you have to measure, the safety performance, and you should be able to calculate the return on what your organization has invested on the safety. So 3.1 is analyze the way in which error management can improve the safety performance in occupational health and safety management system. First thing is very simple. Being a top management, being a part of strategic management of an organization, you should know the error management. Error management means that you have a proper management system there, which is working on the errors which are arising during the implementation of occupational health and safety management system. So this error management can identify errors, the issues, and then the controls apply to remove that errors. So in this 3.1, you have to explain, you have to perform an analysis that how these error management systems are working and how they are improving the safety performance in occupational health and safety management system. And do remember that you will do this discussion with respect to your organization, like what type of error management system your organization have in place and how has in place and how well that is working for your organization. You have to explain that, but it should be with respect to occupational health and safety management systems. Then 3.2, develop a practicable model for calculating any returns on the occupational health and safety management system in operational and strategic terms. First of all, I have told you before in my last lectures and many times in my other lectures that health and safety is a qualitative thing. It is not a pure quantifiable thing, because as all of you know that there is no pure mathematical term is there that can be used for calculating the health and safety. So there are some statistical terms we use there, and statistical is basically a subject of supposition, as assumptions, that you are assuming the thing, you are supposing the things. So it is mainly a qualitative thing, but still what you have to do when it comes to the returns should be, and returns are actually in a term which is which you can see, which you can understand easily with respect to mathematics, that what you have earned from that. And but it is not easy when it comes to occupational health and safety management system. So what you have to do, you have to develop a practicable model for calculating any returns on occupational health and safety management system. Like what you have invested time, you have invested human resource, you have invested the finance, you have invested the money. Like, so how you are calculating them. So whatever the practicable model do you have in your organization, actually you have to explain here. And also you have to provide the evidence that what type of practicable model your organization is using when it comes to calculating any returns on the occupational health and safety. So you have to explain that, you have to give the explanation on that. Next we have 3.3, develop a data evidence method that measures the performance of the safety culture. Data evidence method means that there should be a number. There should be a number. Like, for example, I'm saying that my organization safety culture is improving. To show that improvement, I have to produce some numbers. How I can say that? I can say normal, for example, I will say that we have performed 100 activities in this year. and the 100 activities in the previous year. But previous year, we have 20 accidents. And now this year, we have only 9 accidents. So it shows that there is a specific some significant improvement there. So this is a data evidence which I am providing to you. Anything which is coming from a number, we call it data evidence. So you have to explain that what type of data evidence method your organization is using to measure the performance of the safety culture. And if still your organization is not using any data evidence, it is not possible at all, because if you are part of a strategic management and if you are part of a top management, it is normal, it is usual that you should have a data evidence method in place there. So you have to explain that data evidence method, and if you have some past reports on that data evidence method, that calculation, the numbers are there, then you can use that, and you should use that data evidence method reports as an evidence to support your this explanation. Now we are on learning outcome 4. Level 4 is about understand the effects of psychological health and injury management in the workplace. Psychological health means your mental health and your well-being actually. Stress, anxiety, depression, these are psychological issues. These are mental health issues. And injury means that you are having a physical issue or physical illness in your body, that when it's come to physical, it's injury. Now 4 point, so this learning outcome will discuss the psychological health, the mental health, and the physical health of the workers working in a workplace, and how you are doing the management there. Actually, it is not discussing simply that what is psychological health and injury. It is discussing about the management your organization have for what, for managing the psychological health issues and injuries in the workplace. So the 4.1 is evaluate the role of management in promoting good mental health within the workplace. So here, what you have to do, you have to see in your organization that how your top management is working on promoting good mental health within the workplace. That what are their steps, what are their management techniques, what is their policies for this purpose. You have to explain that, you have to assess that, what type of management policies or management actions are taken in your organization at the top management level, and how good they are working and how good they are doing. You have to explain here. 4.2, analyze the challenges in dealing with mental health within the workplace. So when you are dealing with the mental health issues in your workplace, it is not easy, because dealing with the people or the workers working in the workplace who are facing mental health issues cannot be easy. So you have to explain here that in your organization, when you are managing the mental health within your workplace, what are the challenges, what are the issues, what are the barriers you are facing in your organization, you have to explain here. Then 4.3, analyze the way in which the human rights of workers with mental health conditions should be protected in the workplace. So there is an analysis. The way in which the human rights of worker, like you are dealing with with the people who are having psychological issues, who are having mental health issues, you can't treat them beyond the limits of human rights. Anything you will do, even you are doing rehabilitation for them, even you whatever the whatever decided by your management you are doing, it should not be beyond the limits of human rights. Whatever you will do, even for their betterment, what you have to do, you should remember that the human rights of worker with mental health condition should be protected in the workplace. Okay, so you have to be in limits of human rights whenever you are managing, do it, even you are testing them, even you are doing examination of them. So all the time you should be in limits, in the limits of human rights. So you have to explain also that how your organization is working toward this, and how you people are managing, how you people are handling the workers with the health issues in your workplace by keeping in mind the human rights. Now the 4.4 is analyze the factors and conditions contributing to possible workplace violence. You have to explain here that what are the factors in your organization and what are the working conditions in your organization that are contributing to possible workplace violence. Then 4.5, why, what is violence? When you are normally, when things are not in control and workers are not having good time in the workplace, and things maybe not not wrong even, but the perception of mental of the workers who are having mental health issues can be different, and it can create violence. In result of that, a unsafe workplace will be there. 4.5, analyze the early indicators of workplace confrontation. So if some type of violence is there in the workplace, there should be some early indicators of workplace confrontation that are giving warning to you, that are giving opportunity to you actually, that you should correct the things to stop the workplace violence. So you have to analyze that what are the early indicators of workplace confrontation that can cause big problems in the form of violence and unsafe workplace. You have to explain here. 4.6, analyze the barriers to the implementation of a psychological health and safety management system in the workplace. Okay, here in your organization or even in normal, you have to explain that when you are implementing psychological health and safety management system in the workplace, what are the barriers you are facing, that what are the barriers you are facing, what are the difficulties you are facing in your workplace, you have to explain that. 4.7, analyze the ways in which an injury management program can have an impact on a worker's morale. So do remember that whenever you are managing health and safety properly, even you are doing good after some accident or incident or some injury, still your workers' morale will remain high. And if after the accidents, after the injuries, after the incidents, if organization is not taking that serious, even there is no big loss there, the workers' morale will go down. So in this assessment criteria, you have to explain that how the injury management program can have an impact on workers' morale. That what happened to workers' morale when you implemented as when you have an injury management program there, you are taking care of workers' injury. So what will be the impact on them? So you have to explain that here. 4.8, we have evaluate the potential cost of poor psychological and physical health and poor morale can have on an organization. Here, in this assessment criteria, before this assessment criteria, this learning outcome was discussing only the positive things, that you do this will be the impact, this will improve that, all these things are there. Now in this 4.8, it is saying that if you are not having a proper injury management system there, you are not taking psychological health issues seriously, then what happened? What can be the potential cost of poor psychological and physical health and poor morale can have on an organization? First thing is that if you are not having a proper injury management system there, you are having a poor psychological health issues handling techniques there. So what are the costs you have to face, and even how much it will create an impact on the workers' morale. And then definitely if workers' morale go down, then definitely the organization has to face the music in the form of potential cost. They have to bear that. So just I have completed the learning outcome 4 of the unit 2 of this Proqual level 7 diploma in diploma in strategic health and safety management and leadership. Now I have the last learning outcome number 5 and its 5 assessment criteria. So in 5, in learning outcome 5, we can see here it is discussing about be able to lead the implementation of a whole organization approach to occupational health and safety. Basically, whenever you need or you want to achieve your organization's objectives, your organization's aims, and your organization's target, do remember individuals' performance can't create a big impact. What is required from you, from the organization, is that there is a whole organization approach there. Without any whole organization approach, you can't get the expected results. You can't achieve your objectives. You can't achieve your aims and targets. to achieve that, you should have an implementation of a whole organization approach to occupational health and safety. And then, because you are part of a strategic management, you are part of a top management, you should have an ability. What ability? To lead that implementation, to lead that whole organization approach. If you don't lead that, even you have developed the approach, you have implemented that, but it will not work if you don't have a proper leadership there. So top management is responsible for that leaders, for that implementation. So here it is discussing about the whole organization's approach, implementation in the workplace, in the implementation in the organization, and then it should be led by top management. 5.1 assessment criteria is evaluate the case for the integration of occupational health and safety into an organization's business activity. You have to explain here that how you are integrating, making an important part of something. Integrate. You have to make something a part of any system, anything, you call it integration. That it is asking about that evaluate the case of the integration of occupational health and safety into organizations' business activities. That take it as an investment. It will definitely pay you back. So how your organization has integrated the occupational health and safety into an organization, into the organization's business activities, you have to explain here. You have to produce some evidences if you have with you, like how your top management perform well with the respect of any report they have integrated, any discussion, any meeting, according to that can be good for this. 5.2, develop a practicable whole organization approach to occupational health and safety in an organization. You have to develop a practical whole organization approach which can be acceptable in the organization, which can be implemented in the organization. We can implement that. You have to develop that. And what type of organization, whole organization approach do you have in your organization? You can also explain here. 5.3, analyze the relevance of a whole organization approach in tackling bullying and violence. Do remember that in your organization, bullying and violence are the two things which can set the tone of your health and safety culture, and then the occupational health and safety management system. So you have to explain that how relevant is your whole organization approach with respect to your workplace. Because if there is no relevancy, then you don't have control over your organization. So you have to explain the relevance of a whole organization approach in tackling bullying and violence in your workplace. You have to analyze that. Then 5.4, scope the nature of interdependence in the components of an occupational health and safety system. Do remember, any management system, not only occupational health and safety management system, every management system can perform well only when interdependence components are, when the components of management system are having interdependency. Interdependency means that they are interconnected. Only that management system can work. So when it comes to the occupational health and safety, the nature of interdependence in the components of an occupational health and safety system will decide that how strong, how much stagnant this management system is, which is implemented by your organization. You have to explain that, and what are the components of occupational health and safety system do you have in place in your organization. So do remember, whenever it's possible, sometimes it's not possible, but whenever it's possible, mold the information with respect to your organization, provide evidences to strengthen your explanations, what you have said, what you have explained there. So it can really give a good understanding to the assessor, and even it is the basic purpose of this qualification, that you should know that how you can use your knowledge within your organization. So the last one, the last learning outcome and the last assessment criteria. 5.5, develop a strategic response and operational plans that address aggregated independent health and safety, interdependent health and safety risk. So your organization, you have to see in your organization that you have created some responses, you have developed some responses, and operational plans are there that can address aggregated interdependent health and safety risks. So whatever the plans, what are the responses you have to explain there. You have to provide the proofs there. You have to provide the evidences there to support your explanation. So here it is. We have completed the unit 2 for this level 7 diploma, and I hope it will work for you. And if you are having any issue, my email address, my phone number is there. You can ask any question, any query do you have, you can ask from me. So definitely I will respond there, and we'll see you soon in the next lecture. Thank you very much. Thanks for your time. Have a good day. Goodbye.